We have a second presumptive case of COVID-19 in Alberta, this time in Edmonton, in a man in his 40s who recently returned from a trip to the United States. Because this lab result just came back, we do not yet have details on this person's activities since they returned from their trip, but I am sharing this information in order to be transparent and to meet our goal of sharing information with the public when we have it. This person had a travel-related infection, had just come back from a business trip where they had visited Illinois, Michigan, and Ohio. And it's my understanding that the individual who was traveling with them does have symptoms. We will be following up and making sure that that person gets tested. But again, I have very little information beyond that fact at this time. And again, as we learn more with our public health investigation, I will let you know what we learn. I know many Albertans have concerns. We continue to treat this very seriously. I want to stress that the risk of getting sick from COVID-19 remains low at this time in Alberta. However, with these recent developments, we are anticipating this risk may increase in the weeks to come. The virus continues to spread around the world. The research and data continue to grow and evolve. And we continue to adapt our approach based on the latest and best evidence available. In light of these recent developments and the continued spread of the virus, Alberta will now be expanding testing protocols across the province. Effective immediately, we are advising all travelers returning from any destination outside of Canada to monitor their symptoms. If they experience influenza-related symptoms, such as a fever or cough within 14 days of their return, they are asked to self-isolate immediately and call HealthLink at 811 to arrange for follow-up testing. Over the past 24 hours, as you can imagine, there has been a tremendous amount of work that's been happening within the system to increase testing capacity. I don't have a precise number for you in terms of the number of tests that we can do, but I will tell you that it's our priority to make these tests happen quickly and to move them through the system quickly so that we can do public health follow-up should we get any positives. And so we have expanded beyond the number that I had originally provided, which was 200 per day. The number has been expanded beyond that, but again, I don't have that precise number because we're in the middle of calibrating and determining if there are some tests that aren't clinically necessary that we can stop doing in order to free up capacity to focus on COVID testing. And so all I can say is that the focus remains on enhancing our capacity to meet the demand, and I don't have a firm number to give you.